Welcome to your last single week unit in the surgical procedures course. We are really winding down to the end of your program, so please keep up the hard work because before you know it, May will be here. As we begin discussing thoracic and pulmonary surgery, you will have to apply this information to the cardiac unit too, because the lungs and heart depend on one another. First things first. Thoracic and pulmonary surgery include the respiratory system and everything within the thoracic cavity except the heart and cardiac vessels. That means it includes the distal trachea, bronchi, bronchioles, lobes of the lungs, pleura, esophagus, and thymus. Speaking of the thymus, do you know what it is? The thymus is an immune system gland comprised of two lobes. It sits anterior and superior to the heart, but behind the sternum in a cavity called the mediastinum. It is responsible for producing T cells, which are vital for one's immune response. Another fun fact, it begins to atrophy as humans reach puberty. Do you recall another lymphatic structure we've already studied that also atrophies as we age? Although surgery may occur on the thymus and esophagus within this specialty, by far the most surgeries performed are the lungs, bronchi, and peripheral bronchial system. A pair of TED-Ed assignments have been created that freshen up your knowledge of the anatomy and physiology of the respiratory system. And in them, they discuss the function of this important system, which is to transport oxygen for our body and release carbon dioxide from our blood due to cellular metabolism. Over and over, we've discussed the anatomical structure that separates the thoracic cavity from the abdominal cavity. What's it called again? In addition to this structure dividing the thoracic and abdominal cavities, it is a sealed barrier, and it is continuous with the parietal pleura. We'll talk about the pleura more in just a little bit. But first, here's that shameless slide that reminds you to review the terms and definitions listed at the beginning of your chapter. There are some pretty important ones which we'll discuss on the next slide, but you are responsible for knowing them all. 3 super duper important medical terms related to the pulmonary system are ventilation, diffusion, and perfusion. Ventilation is the breathing process. This involves the contraction of the diaphragm and accessory muscles and expansion of the ribs to pull air into the lungs with every breath. Diffusion is how oxygen from the alveoli in the lungs move into the bloodstream. And perfusion is oxygen transport from the blood into the body tissues. When we measure O2 sats with that little clip monitor on the patient's finger, we are measuring perfusion of oxygen into the body tissues at the capillary level. The trachea begins at the larynx and branches into right and left primary bronchi at the carina. Because of the anatomical differences between the right and left bronchi, foreign material such as food is more likely to be inhaled into the right lung. And speaking of the right lung, how many lobes are in it again? How many are in the left? Why is that? This slide shows a zoomed-in view of the alveoli at the end of the bronchioles. It is right here that the exchange of oxygen and carbon dioxide occurs. The bronchioles are composed of smooth muscles lined with epithelium, and the alveoli are 1 cell thick, thereby allowing gas exchange. Between the lungs is the mediastinum. It is a central compartment of the thoracic cavity encased in loose connective tissue. Within it are the heart, large vessels, trachea, esophagus, and thymus gland. I like to think of the thoracic cavity as a house, and inside the house there are bedroom and living room. These 2 rooms represent the right and left lungs, but another key component in a house is a kitchen. In a typical kitchen, there's a stove and a fridge and a microwave, and in this analogy, the kitchen is the mediastinum, in which the trachea, esophagus, heart, great vessels, thymus, and lymph nodes live. In studying the mediastinum within the thoracic cavity, it's easy to get confused what is where. but if you just remember that there are no beds or couches in the kitchen, you'll remember that the lungs are not in the mediastinum. Each lung is enclosed in the pleural cavity and covered by a double membraned pleural sac. The outer portion is the parietal pleura. The inner layer of the sac is the visceral pleura. A specific amount of fluid is maintained between these two spaces and prevents friction of the two pleural membranes. If you've ever washed dishes, you know the way it feels when two plates are wet and are stacked up on top of each other. They slide around, and they also create this suction between them, so it's kind of difficult to separate them from one another. That is exactly what the pleura is like. So, to recap, the lungs are paired organs that reside in the thoracic cavity, separated by the mediastinum. They are enclosed in the pleural cavity and covered by the pleural sac. The lungs expand and contract based on negative pressure, which is created in the space between the two pleural layers. Remember when I talked about the wet plates and how they like to stick together? Well, we call that negative pressure. And one more component to negative pressure is that in order for it to be called negative, the pressure on the outside must be higher than the pressure on the inside. When this happens, the structure or structures within the negative pressure will constantly try to suck stuff in, like a vacuum, which is the exact opposite as the pressure in the operating room. Make sense? Okay. So now I want you to picture in your mind a bagless vacuum. It's plugged in and it's turned on and it's being used to suck dirt up off the floor. You got that image in your mind? Okay. How the suction is created once the machine is on and the dirt flies around inside that chamber occurs until the machine is turned off. When the machine turns off, what happens? Yeah, all the dirt falls into the bottom of the chamber, right? That's exactly what happens to the lungs if the integrity of the pleural cavity is broken. The lung will collapse and fail to continue sucking air into itself because the pressure will now be the same as the pressure outside. So, we breathe in, the diaphragm muscle contracts and decreases the space between the pleura and the lungs, which causes air to be pulled into the lungs. This is called inhalation. When the diaphragm relaxes, the space between the pleura and the lungs is increased, which results in exhalation. Because the pressure in the pleural space is negative and the atmospheric pressure is higher, our lungs are constantly performing that sucking action, and that's precisely how our lungs stay inflated. Should the pleural cavity be disrupted and a lung subsequently collapses, there are two common causes: air or blood. If air is the culprit, this is medicinally known as a pneumothorax. If blood is the culprit, it's called a hemothorax. Regardless, if air or blood are present, that's abnormal. So, breathing will be affected, and the structures surrounded by the lungs can be shifted. In addition to pleural cavity disruption, there are other physical factors that can affect ventilation, such as inelasticity of the alveoli, or issues regarding the phrenic nerve, which controls the diaphragm. And in this video here, I wanted to show you the diaphragm working and watch how the ribs expand and then contract. Okay, so here you see the diaphragm working. And when it contracts, it pulls down, and that pulls the ribs open. And when the ribs open and the diaphragm is contracted, that is when the lungs expand and the space between the lungs and the pleura are decreased, and that's what allows us to take in a full breath. Then, adversely, it relaxes, and when it relaxes, the ribs come back down, and that's what pushes the air back out. So, in, out. Here's an underside view, and I just really wanted you to see the anatomical holes in the diaphragm which allow for the esophagus to come through the diaphragm and hook up to the stomach, and also the vena cava, which comes in through the abdomen and up above the diaphragm to hook back up into the heart. Okay?